So I just want to kick things off and say thank you to everybody who has signed on this evening. This evening we'll be presenting a panel on Pennie, the new Pennsylvania State Health Insurance Exchange. We'll be able to learn all about Pennie, and that'll be the new way that Pennsylvanians can shop and purchase health coverage. And that'll include the transition from healthcare.gov, how to enroll using Pennie, how to shop through Pennie, free options for customer assistance, and how to apply for financial assistance through Pennie. This evening, we are joined by three panelists from Pennie. We've got Zachary Sherman. He is the executive director at Pennie. Zach is no stranger to state-based health insurance marketplaces. He was instrumental in launching Health Source Rhode Island in Rhode Island before coming to Pennie. And we also have Scott Yeager. He is part of Pennie's outreach team. Professionally, Scott has been in outreach for nearly 20 years, serving institutions like the Pennsylvania State University, the University of Pittsburgh, and Clarion University. Scott is also a licensed insurance broker. And we also have Juan Valencia. He's part of Pennie's outreach team. Juan most recently served with the U.S. Census in Lancaster County. Juan is an entrepreneur with over 25 years of experience in working with business and communities in Philadelphia and southeastern Pennsylvania. And with that, I will turn it over to you three. Again, thank you so much, and enjoy this evening. Thank you so much.
Thank you, Sarah. Thanks so much for the opportunity to be here and to talk to you all a little bit about this important new program in the Commonwealth and what it means for Pennsylvanians. So kicking it right off, as Sarah mentioned, my name is Zach Sherman. I'm the executive director of Pennie, Pennsylvania's new state-based health insurance marketplace. If you go to the next slide, please. We're going to tell you a little bit about the program itself. We'll give you an overview of Pennie. We'll walk you through the customer experience, the broker and assister experience, how customers connect up to brokers and assisters. We'll tell you a little bit about the uninsured across the Commonwealth. And then lastly, we'll tell you about how you can help spread the word. This is a new state program. We're very eager to have this opportunity to tell you a little bit about it, and then to also ask you to help us spread the word and get information out about the new program as well as the current open enrollment period. So starting with an overview of the program itself, and allow me to start with the name, Pennie. Pennie is a representation of who we are and what we do. It comes from the combination of Pennsylvania, Penn, and insurance exchange, i.e. together that gets you to Pennie, and that's the name. We don't actually refer to it as an acronym. That's just where it comes from. It's simply Pennie. It's intended to be a safe, approachable, friendly, unbiased resource for Pennsylvanians to access free services, financial assistance to help pay for coverage, and the peace of mind that comes with being insured. So our overarching goal is to improve the accessibility and affordability of individual market health coverage for Pennsylvanians. We do this by being the official health insurance marketplace for the Commonwealth, for Pennsylvania. The very important point here is that we have replaced healthcare.gov. We're not complementary or supplementary. We are now the marketplace that is replacing healthcare.gov. If you go to healthcare.gov right now and type in a PA zip code, you'll get redirected to our website, same as if you give them a call. We are the home for high quality, affordable health insurance plans. And importantly, we are the only, we are the only source for financial assistance to both reduce the monthly cost of coverage and in some cases, the cost of care. We do this by a couple different financial assistance mechanisms. We help for those that are eligible to pay for monthly premiums, and in some cases we help to pay to reduce the cost of your deductible, your copay, your coinsurance. A big overarching important question is why get covered? Why get coverage? Why is this important? I would offer protection against the unforeseen. Peace of mind is very important. Protection against financial ruin in light of a medical catastrophe of some kind. All those are good reasons to have coverage. Accidents happen, illnesses happen. Health insurance gives you the peace of mind in uncertain times, and we are certainly living in an uncertain time with the global public health pandemic. And then, on the other side of it, access to preventative services to ensure that you catch things before they become problematic, that you're doing your annual checkups, that you have access to the preventative services at no cost that you need is a really key component of living a healthy and stable life. So those are all reasons why we think it's important to get covered. We strongly believe in having access to coverage, where you get it, whether it's through us, with our assistants, or anywhere else. We just want to see everyone get covered. We help in a number of ways. We have a dedicated customer service team that provides assistance to customers calling in, but also our various stakeholders, our brokers, our assisters. We have a number of online self-service tools. We have general information about the plans that we offer. We have decision support tools that allow you to punch in information about your household size, your household income, and it gives you a sense of what financial assistance you might be eligible for. We also have the ability to do apples to apples comparisons of your plan options, your prices, your total out-of-pocket costs. We strive to give you the online tools to make the right decision for your health needs, for your budget. We also conduct a considerable amount of outreach and education. We have dedicated support in community organizations across the Commonwealth, providing in-person assistance to help enroll in coverage. We also have teams doing active outreach where throughout this open enrollment period, we're doing dozens of in-person or virtual enrollment events to help people navigate and enroll in coverage. And just building on that, we have great partners through our in-person assister, our navigator assister network, and also through our broker partners who go through training and get certified with us, and then have the ability to provide advice on health plans, which can be very key for some people who need help navigating the process. Just a little bit about how Pennie came to be, why the Commonwealth decided to make this change and implement this program. In 2019, there was general agreement that the Commonwealth was paying a lot of money for use of healthcare.gov. I believe in 2018, it was around $98 million just for the use of healthcare.gov. Leadership in the Wolf administration and the General Assembly came together and realized there was a better way. There was a better way to do more for the Commonwealth, save money, invest that money in affordability, in achieving more affordable health coverage, and they made it happen. They came together and they passed unanimously through both chambers of the General Assembly. They passed a piece of legislation that created Pennie, created a state-based marketplace, and with the money saved, created what's called a reinsurance program, which effectively brings down the cost of monthly premiums from what they would have been absent that program. So it funded two programs for the price of one, and was really a big win for the Commonwealth and resulted in unanimous passage through the General Assembly and was signed into law by Governor Wolf in July of 2019. With that, with the existence of the state-based exchange of Pennie, we have the flexibility to react to changes and serve residents in a way that's best for them. We have local control of our in-person assistance programs. We can put more resources there. We have the ability to do specialized and additional education, communication, customer service team. As I mentioned, we're doing it for less money, decreased operational costs, and the ability to keep that money in state. We also have the ability to invest that money in premium savings, and that's already paying off. The plans that are being offered for 2021 right now are actually 5% lower than they would have been with the creation of this program. We have the ability to work closely with our insurance partners to foster a competitive marketplace, and the ability to coordinate with our partners at the Department of Human Services, two state entities working together to ensure populations that come to us or who are deemed eligible for Medicaid or CHIP have the ability and the safe path, the easy pathway to get over to the right program to get enrolled in coverage. As I mentioned, it's important that we think it's important to get covered. Whether or not we're ultimately the place that provides that coverage is secondary to the goal of just getting you covered. I touched on this a couple weeks ago. The insurance department announced the 2021 plans, as well as the changes in prices year over year. And the great news as a result of these two new programs is that premiums are actually lower than they would have been and are actually going down next year for 2021. On average, they are decreasing statewide by about 3%. So it's this initiative is already having a return. It's having a return in the form of lower premiums than they would have been without these programs. A little bit about our timeline. We are now into November. We are now into our first open enrollment period. Open enrollment has typically run for 45 days from November 1st through December 15th. Another benefit of having local control is our ability to set policies around enrollment periods, among other things. We decided we wanted Pennsylvanians to have more time to come in and get covered. So our open enrollment this year is going to run from November 1 through January 15th. That's an additional month that Pennsylvanians will have to come in and get covered. A couple of key dates I want to call out on this slide. One is to be enrolled for January 1 coverage. It's important to come in and get covered and pay your first month premium by December 15th. That's the deadline to come in and get January coverage. If for whatever reason you decide to come in from December 16th through January 15th, you can still get covered. It's still open enrollment, but your planned start date will be February 1st instead of January 1st. So naturally, we're eager for folks to be covered all year, so we're driving them to the December 15th date. But again, for whatever reason, if you need more time or people don't get to it, there's still more time to come in and get enrolled for February 1 coverage. So a little bit about the Pennie customer experience. We are now open. We're now open in open enrollment. The first job we had related to Pennie customers was making sure that those existing healthcare.gov customers had a easy transition from the federal platform to the Pennie platform. So if you're an existing customer or if you haven't had an account on healthcare.gov, we went through a process on the technological back end of migrating application and enrollment information over to our program. And for those that were enrolled, gave them the ability, if their plan was still available, to renew in coverage if that's what they'd like to do. So we started communicating to existing customers about this transition at the end of October. We sent a number of required communications out to customers about how to come in and claim your account, how your eligibility is changing, if it's changing at all, and information about the auto renewal process. So all of those communications have been actively going out to existing customers. For existing and new customers, the way to enroll in coverage, there's a number of ways in which you can do that. There's steps you can take. You can skip steps. We try to make it as tailored and as simple as possible for what you want to do. So a number of things you can do around navigating the online enrollment processes. If you don't want to apply yet, you just want to come in and look at your options, you can anonymously shop. We give you the ability to anonymously give us a little bit of information, household size, rough estimate of your income. That'll let us know and be able to give you a sense of if you would be eligible for financial assistance. You give us that, you put that info into the anonymous browse, it spits out information, and then you can see an apples to apples comparison of and a quick quote without creating an application. If you want to get into it, you can start here. Of course, you can apply for coverage. To enroll, you need to be deemed eligible. So we need some information around your household and your income, your household size and your income information. You fill out an application, we'll run it through a process and give you the result of whether or not you should be eligible for financial assistance to help pay for coverage. If you are qualified, for financial assistance, then you can apply that how you see fit, including upfront on a monthly basis to help reduce your monthly costs. I mentioned this earlier, the way in which we provide assistance around shopping. You can filter by insurer, by deductible, by your monthly premium, by out-of-pocket costs. There's a number of different ways that we allow you to compare and filter and shop in the interest of really allowing you to filter down to what's most important to you for your healthcare needs and your budget. And then lastly, enroll in coverage, find the right plan for you, and pay your first month's premium, and then you're covered. A little bit about eligibility, a little bit more about eligibility. To be eligible to enroll in coverage through Pennie, you need to be a Pennsylvania resident who is a citizen or lawfully present in the United States. If you meet that criteria, you are eligible to come in and get covered through Pennie. There is there's an additional eligibility step if you're interested in financial assistance to help pay for coverage. Most of our customers are ultimately deemed eligible for financial assistance. Nearly 9 out of 10 qualify. And as I mentioned, qualification is based on income and family composition. But a good rule of thumb there is if you're an individual who makes less than $51,000 a year, or a family of 4 making less than $105,000 a year, you're likely to be eligible for some form of financial assistance to help pay for coverage. So it's worth checking out. The 2 types of financial assistance are the monthly premium savings. It's a tax credit. It's called an advanced premium tax credit. It lowers your monthly health insurance payment. And the way in which we determine your eligibility is based on your expected annual income. We'll ask you, what do you expect to make in the coming year? You'll give that to us. We'll bounce it off a couple um, data sources to see if it lines up. But basically, that's the long and short of it. If you qualify for the APTC, you can use that amount in full to apply to your monthly payment, or you can use a part of it, or you can actually take it at the end of the year on your taxes if you'd like. The other financial assistance relates to a subset of the folks eligible for the APTC. It's on the lower end of the income spectrum. This is additional financial assistance to reduce the cost of your deductible or co-payments. And if you're qualified, the very important distinction here is these are only available through our silver plans. You cannot apply them to bronze or gold or platinum. So um, be sure when you're checking this out to see if you're eligible for this type of assistance, that it only kicks in, it only works if you enroll in a silver plan. So lastly, I just wanted to tell you a little bit about the health insurance offered through Pennie. We offer both health and dental plans, and these are the same commercial insurers that have been offering in previous years through healthcare.gov. We have them listed here on the slide. I won't read through them all. They vary by the region of the state that you live in, but here are all that are offered. A couple important things to call out is that it is a requirement that all of the medical plans that we offer provide and cover the 10 essential health benefit categories. And these include, among other things, the no-cost preventative services, emergency services, inpatient, prescription drugs, behavioral health services, among other things. A couple other things to call out is if you have a pre-existing condition, that is not a reason that you can be denied coverage. So it doesn't matter if you have a pre-existing condition, all of these plans are available to you regardless of that. And another important benefit is that if you have kids, kids under the age of 26, and you're enrolled through Pennie, your kids can be on your plan as well. So with that, Scott, I think I'm going to turn it over to you, and you're going to talk a little bit about brokers and assisters and how customers can get connected up to them.
All right. Thank you so much, Director Sherman, and thank you to everyone who has taken time out of your week to join us here to learn about Pennsylvania's newest agency. And Pennie is definitely here to serve not only our customers, which are first and foremost, but we also have partners such as our Pennie certified brokers and Pennie certified assisters who provide essential essential services for us to be able to connect individuals here in the Commonwealth to the health insurance options that they need the most. A Pennie certified broker is an individual who, within the Commonwealth of Pennsylvania, they can make a professional recommendation to a customer. They can also, because of their training and because of their level of expertise in the insurance industry, they can work on some of the more complicated issues that people may encounter with regard to health insurance. First and foremost, our goal here at Pennie is uh, to try and change how people view health insurance and how people relate to health insurance. We do that first and foremost through our customer service representatives at the Pennie call center, as well as through our Pennie certified assisters across the Commonwealth of Pennsylvania. Those individuals, the customer service representatives and the assisters, are within Pennsylvania law. Those are the individuals who can help guide a customer through the health insurance process of becoming insured, not only connecting with the plan that's right for them, but also making sure that they're well educated and well informed about their purchasing decision. The only individuals in the Commonwealth of Pennsylvania who can actually make a professional recommendation and guide that customer to that product or to that type of health insurance that is best suited for their needs is a Penny certified producer. They are registered with the Pennsylvania Insurance Department, or licensed, I should say, with the Pennsylvania Insurance Department, and they are registered through Penny. They complete an 11 module training course through us. And once they do that, they start assisting customers in building their book of business. When it comes to our brokers and assisters, they are able to access their accounts from penny.com. And this is a snapshot of our website. You'll notice on the left-hand side, our assisters and brokers can utilize that portal right there to log in and start servicing customers. And our customers off to the right, they can click to log into their account if they have an account with Penny. If they don't, through clicking Get Covered, the big gold button there, they can actually click Get Covered and start that account claiming process. Again, they always have the option of reaching out to the Penny call center for assistance. Our customer service representatives at Penny are unbiased. They are individuals that provide free help. All of our producers and assisters and CSRs provide assistance at no charge to our customers. We are here to make sure that our customers are taken care of. And we do that in large part through our brokers. Within our broker community, we also have guides and resources that are available for our assisters and producers. We update these frequently as we discover things that need to be adjusted so that our brokers and assisters can better interface and serve our clients. We update these guides and manuals quite readily. Um, Now, in terms of how a customer connects with a broker on penny.com, um, it's pretty nice how we've got things set up in terms of accessibility. You remember I keep coming back to our customer support number. This is the actual customer portal in penny.com. If a customer clicks uh, get covered, if a customer clicks on or logs into their account, they'll have three options. They can browse for health plans. Now, the interesting thing to point out is something that Director Sherman mentioned as well, is that as a customer on Penny, you can actually comparison shop without creating an account. There is no pressure. There is no hard sell. There is no, individual or group of individuals hovering over you saying you must purchase insurance. You're our customer. And from word one, we want to make sure that you are in the driver's seat. Okay. So from that vantage point, you can shop anonymously for health and dental plans. If you have an access code as a customer, if you were sent an access code by Penny, you can click here and register for your account either by way of access code, or you can also utilize your social security number. If you already have an account with Penny, you can log in here. But an important thing to point out is when you're at penny.com, you are never alone. Okay. Help is always available. In the upper right hand corner here, you'll see where we have laid out under the drop down menu here. A customer can always reach out to 1-844-844-8040 and speak with a human being. And the interesting thing about that is they can connect with a Penny customer service representative in English or Spanish. And we also have a language line at Penny that provides over 240 different languages that we can help individuals, uh, whether it's Mandarin or whether it's Farsi or what have you. We can help them connect with health insurance and help guide them to the resources that they need. Also, I'd like to point out something very important, and this addresses how a customer can connect with a Pennie certified broker or assister. They click on Find Local Assistance. Okay. When you click on Find Local Assistance, it takes you to this portal. Here you have a choice. And again, as a customer at pennie.com, you're in the driver's seat. If you would like to connect with a Pennie certified broker, you can click here to connect with a broker. If you want to connect with an assister for unbiased assistance, you can click here to connect with an assister in your area. We have community health centers across the Commonwealth of Pennsylvania, and the assisters that are in your local region, again, they would be most uh, eager to help you get insured. But in this case, in the example, we're clicking through to a certified broker. When a customer brings up the fact that they want to search for a broker, the first thing that they can do is enter their zip code, and they can set a distance, whether it's 5 miles, 10 miles, 30 miles from their home. I, being from north central Pennsylvania, I know that there's, especially when you get into rural parts of Pennsylvania, there's a lot of dirt between towns. So having the ability to extend your search is always helpful. You can also select your language option. Here's the thing though, if you know of a particular health insurance agency or a particular insurance agent in your local area that you want to see whether or not they're a Pennie certified broker, you can use the first name and last name of the individual broker, or you can search by the agency name as well. Okay. In this case, we're going to search by radius based on zip code. And what you'll see is you'll see a number of agents that come up in that search. Now, from here, you can review their, and this is, again, this is high level overview. You can review the languages that they're fluent in, or that they offer services in at their particular agency, their expertise in terms of products, as well as their distance from where you are. Once you select a particular agent that you would like to work with, at that point, you can pull up their profile. You can search by number. You've got their contact information, their email address, and you can also see physically where they're located in your community. When it comes to impacting the uninsured in the Commonwealth of Pennsylvania, it is a concerted effort. Um, and that concerted effort, again, comes back to community members that are first and foremost well educated about who Pennie is and what we do. Then we've got our customers. They are the individuals that can provide us with the best reference of all. They're the individuals that can help spread the word about their experience that they've had, purchasing and shopping for insurance here at Pennie. In addition to that, we've got our customer service representatives, assisters, and of course, our Pennsylvania Pennie certified brokers. I mention all of that because without that collective, um, our health insurance exchange it's like a sail without wind. We are a boat on dry land in many respects. So it takes a community to help impact some of these numbers that I'm about to share with you. First and foremost, and these are pre-COVID numbers. So, as it stood, we had in 2018, we had 6,000 or 607,000 uninsured in the Commonwealth of Pennsylvania. That breaks down to about 1 in 20 individuals. And when you think about that, um, you probably pass more people at a convenience store or more individuals at a traffic light in your community. Um, Again, 1 in 20. When you think about how many individuals are uninsured, um, knowing that we've brought the health insurance exchange home to the Commonwealth of Pennsylvania, where we can work with the insurance companies on, maintaining healthy rates, where we can help individuals get connected with the best insurance options in their markets. Um, that's gonna help reduce the number of uninsured. And we do know where the uninsured live in the Commonwealth of Pennsylvania. And you'll note that um, throughout the eastern corridor, again, on this map, the darker the green, the more uninsured. Our outreach activities, our education activities, like the program that Sarah's helping us with this evening, these activities are all coordinated to help spread the word about Pennsylvania's newest agency, our new exchange, Pennie. We are very proud of Pennie, and we want to make sure that Pennsylvania is proud of Pennie. Our goal is pretty clear. We want to take these numbers that you see here, and we want to reduce these numbers. Um, but it takes everyone to help change opinions, to help change perceptions about health insurance, and that's what we're here to help with. Um, when it comes to how Pennie helps, Director Sherman and myself, we both keep coming back to the service and the assistance that's available here at Pennie.com. We are very proud of our customer service representatives. They are eager to help individuals get connected with the right health insurance options. Our Pennie certified brokers and assisters are also vital resources that can help individuals who may have deep questions about the health insurance process, particular types of health insurance, as well as plans and options through those plans. Just know that there is ample assistance for everyone at Pennie.com. How individuals in the community can help Pennie is something that we always like to emphasize when we reach out to the community. First and foremost, individuals can always refer. Um, Referring a friend, a family member, a neighbor, someone that you know in the community who may be uninsured or who may be in transition. We all know some individuals right now who may be in employment transition. Um, Being able to provide those individuals with a health insurance option in their time of transition is incredibly important. Don't hesitate. Don't hesitate to connect them with Pennie. Going back to what Director Sherman had mentioned before, we have a no wrong door policy because of that. So please don't ever hesitate to refer individuals to us. We'll make sure that they get connected with the right resources. Um, you can also share. Pennie does have social media presence. We're on Facebook, we're on Twitter. We also have an open enrollment toolkit that provides a lot of information. It's at pennie.com/OE toolkit. Um, there are assets that we have that can help you help us spread the word. And any help that we can get would be most appreciated because, quite honestly, no one knows your community better than you do. And a partnership with you in helping us spread the word about the new health insurance exchange about Pennie, um, it would be most appreciated. And in terms of connecting, Pennie also offers an outreach and education work group. That outreach and education work group meets the first Wednesday of every month at 2 o'clock. And we welcome anyone who would like to participate in that work group. It is something that we we value so much in that it provides us with ample information from stakeholders across the Commonwealth. It provides us with the ability to get some direct feedback, because as with any new thing, there are some things with Pennie during this inaugural open enrollment of ours. There are some things that we will do very, very well. There are some things that we'll do kind of well. And there are other things that we need feedback on, because the only way we will become the health insurance exchange that the Commonwealth of Pennsylvania deserves is if we are continually improving and moving in that direction where we can, become better and better every day. And with our partners, that's how we can achieve that. With that being said, what I would like to do is I'd like to open it up to some questions, and I'm going to stop sharing so that we can actually view the chat feature. And I'd like, again, to thank everyone who has participated. If you like, you are more than welcome to take yourself off of mute and ask a question, or if you'd like to drop a question into the chat, please don't hesitate to do that. And we'll be happy to answer any questions that you may have. All right, one thing I'm going to do while we wait is in the chat, I am going to put Pennie's customer service line. Okay. And the reason that I'm doing that is, again, it is always, please know that you are always welcome to share Pennie.com, Pennie.com, and our customer service line with any individual who may have some questions about health insurance, who might have questions about our exchange, or who may need some help connecting with the right resources. That's what we're here for. So if you have any questions, please feel free to, like I said, you can unmute yourself. Oh, here we go. Stephanie has a question. Will I be automatically enrolled in Pennie from healthcare.gov and re-enrolled in my existing plan, or what steps do I need to take now? That's a very good question. Director Sherman, did you want to answer that, or did you want me to answer?
First, gotta get myself off mute.
There we go.
I'm happy to go first. That's a great question. That's the intent. We worked very hard to implement, effectuate the transition in a way that allows for someone who's currently enrolled in healthcare.gov to have their application and their enrollment moved over to our platform. And to the extent that there was nothing barring a customer from automatically renewing, meaning their eligibility didn't change, making them ineligible, or there's no plan available to them based on their current plan that they can renew in. The idea is, in most circumstances, in the vast majority, that yes, that is the intention. That's the way it's supposed to work. If you are interested in coming in and taking a look, you can of course call us. You can also, ideally, you got either through email or in the mail, a notification from us about the transition, including account access code. You can go to our website and use that code to claim your account, to review your application information, to take a look at your renewal status, which is more likely than not an automatic renewal status. And you can, of course, ask us questions along the way. If for whatever reason you didn't get that access code notification, you can also use your social on our website by just toggling from access code to social, and you can claim your account that way. And again, you can call us, and with the right information, you can claim access to your account as well. So, what steps do you need to take? Um, we urge you at the very least to come in and just evaluate and look at your renewal status and your account information to make sure it's all accurate and the same. If you've experienced any sort of change in life circumstances, change in income, change in household size, if you moved, we want to know that information because that's an update to your application and could change your eligibility. So we're interested and eager in you coming in and validating the information, and then confirming that the plan that we've renewed you into is the right plan, or shopping around if that's what you want to take a look at doing. Anything I missed, Scott?
No, actually, uh, don't think you missed anything, Director Sherman. It's just, Stephanie, what I will stress again, um, along this path, if you need assistance on any level, do not hesitate. The number that's in the chat, 844-844-8040. Don't hesitate to call. That's what we're here for. And as Zach mentioned, we are very eager to help you not only review your current plan, and to see how that is reflected in 2021, but if along the way, if we can help you connect with financial assistance, or if we can help you connect with a plan that's better suited for your needs, we can do that. So please don't hesitate to give us a call. That's what we're here for. Does anyone else have any questions?
Yeah, I don't mind asking a question. You can hear me?
Yeah, Dorothy, we can hear you. Thank you.
Okay, great. So I had to change a life status. I lost my job because of COVID, which is very exciting. And I started applying for the health insurance over at health.gov. And when I saw the prices of the plans, I just said, okay, I'm going to do Cobra for another month because it was just more than I can afford. They called me and reached out to me and said that I might qualify for more financial assistance. So they notified me on my application of what my tax credit would be. How do I find out what that further financial assistance will be? Do you only tell me that when I pick a plan? Because I haven't picked a plan yet. Does that question make sense? Because
Totally.
I don't want to pick a plan that I can't afford.
Understood that, having a plan that you cannot afford to use is not particularly helpful to you when you need it.
Right.
So, but the situation you just described, it lends me to think that there's probably as healthcare.gov told you, a good chance that you are eligible for some sort of financial assistance to help pay for that plan. Mm-hmm. And I want to stress the uniqueness of your particular situation, because right now, if you're without coverage and you're looking to get, for example, December 1 coverage, that has to be done through healthcare.gov.
Okay.
Because we begin with plan year 2021 with January 1st.
So I'm not in this thing yet.
Well, I wanted to, I would say your situation is one of those really unique situations that straddles both programs for 1 month because of your circumstances. So if you're looking for December coverage, you need to work with them. But at the same time, for January 1 and beyond, we want to be here to help you and make sure that you're covered ongoing from January 1 forward. And so I'm sorry about the unique situation that you're in where you're straddling
Right.
programs. It's really just 1 month, and it's a real it's a consequence of the transition, right?
It is
And
2020 after all.
it is 2020 after all. It
Yeah.
is a consequence of 2020. But so I would say for 2021, if you go to our website and you go to that anonymous browse section,
Hmm.
even before you file an application with us, right? You just punch in a little bit about your expected income, your household size, where your zip code, and
Mhm.
that calculator right there will just spit out a quick quote and say, based on the information that you provided to us, we think you're eligible for X amount of financial assistance, and here's how you can apply it. And then it'll show you how you can apply that to the different plans that we offer. So if that's even before you apply, if that looks beneficial to you, if that looks like something that is workable and potentially beneficial to you, then you can go into the application process and get going and do it for real for January 1 coverage. So I would urge you at the very least to just go to our website and browse and see what that financial assistance might look like. Again, we can connect you to free assistance in a number of ways, whether it's our call center, whether it's an assister who can sit down with you and walk you through the application process, whether it's a broker who can do that and also give you advice on the right plans for your health needs. I do want to again say I'm sorry about 2020 broadly, but also the December January straddling that is unique to your circumstances. But I do strongly urge you to, at the very least, just take a look at your options, give us a call, and see if we can help you out for January.
Okay, that makes sense. Thanks.
All right. Any other questions? Okay. Well, thank you all very, very much for joining us this evening. And there's Sarah. Hey, Sarah, how are you?
Good. Thank
Um,
you so much, Scott, Juan, Zach. We so appreciate you sharing all of your knowledge and deep expertise with us this evening. It's been so helpful, I'm sure, for everyone who attended the program this evening. So thank you so, so much.
Thank you. We're happy to do it, and thanks for getting on this evening to learn a little bit about this program. And if you want us to come back, we'll come back.
absolutely.
Thank you so much,
All right.
gentlemen. And
Thank you, Dorothy.
Thank you for the invitation.
everybody have a wonderful evening.
All
Good
right.
night.
Be
Thank
well.
you.
Yeah.
Thank you.